Hello everyone, welcome to my channel. In this video, I will talk about few major muscles of upper limb. First, I will discuss all those muscles which arise from scapula and insert into humerus. Rotator cuff muscles are very important part of the shoulder complex. They are also referred to as sits muscle with reference to the first letter of their names, that is supraspinatus, infraspinatus, teres minor and subscapularis respectively. They all provide stability to glenohumeral joint. Talking about supraspinatus, it originates from supraspinous fossa above the spine of scapula and tendon goes under the acromion process and get inserted into the superior facet of greater tubercle of humerus. Nerve supplying the supraspinatus is the suprascapular nerve. Its action is to initiate the abduction up to 15 degrees. Then we have infraspinatus, which originates from infraspinous fossa below the spine of scapula and tendon goes under the acromion process and get inserted into the middle facet of greater tubercle of humerus. Nerve supplying the infraspinatus is the suprascapular nerve. This muscle helps in the external rotation of the arm. There is teres minor muscle which originates from lateral border of scapula and get inserted into the inferior facet of greater tubercle of the humerus. Nerve supplying the teres minor is the axillary nerve. This muscle also helps in the external rotation of the arm. Subscapularis originates from subscapular fossa and get inserted into the lesser tubercle of humerus. Nerve supplying the subscapularis is upper and lower subscapular nerve. This muscle helps in the internal rotation of the arm. Teres major is not a part of rotator cuff. It originates from posterior aspect of inferior angle of scapula and get inserted into medial lip of intertubercle sulcus of humerus. Nerve supplying teres major is lower subscapular nerve. This muscle helps to adapt the humerus and in the internal rotation of the humerus. It also assists the latissimus in drawing the humerus downwards and backward from the flex position, for example when you do a pull-up. Now I will talk about all those muscles that hold the scapula in place, move it in relation to the trunk. There are total 6 muscles, 4 on back, 1 underneath and 1 in front. First, there is large superficial muscle on the back, that is trapezius. Upper traps or descending fibers originate from nuchal ligament, medial third of superior nuchal line, external occipital protuberance and the C7 spinous process. Middle traps or the horizontal fibers originate from C7 spinous process to T3 spinous process. Lower traps or the ascending fibers originate from T4 to T12 spinous process. All 3 fibers converge and get inserted along the posterior border of spine of scapula, medial margin of acromion and the posterior border of lateral third of clavicle. Nerve supplying the trapezius is the spinal accessory nerve. When it comes to action, descending fibers help in the elevation of scapula, also called shrugging, which is useful in clinical testing. Middle fibers helps in the retraction of scapula and ascending fibers helps in depression of scapula. Upper and lower traps also act together to rotate the glenoid cavity upwards. 3 small deep muscles are present on back. First, we have levator scapulae, as you can see in picture. It originates from C1 to C4 transverse process and get inserted on the superior part of medial border of scapula. Nerve supply is cervical nerve C3, C4 and the dorsal scapular nerve. This muscle helps in the elevation of scapula. Along with the rhomboids, it rotates the glenoid cavity downwards. The other two deep muscles are rhomboid major and minor. Rhomboid minor originates from nuchal ligaments and the spinous process of C7 T1 and get inserted into the medial border of scapula or the base of spine of scapula, whereas rhomboid major originates from T2 to T5 spinous process and get inserted into the medial border of scapula or below the spine of scapula. Nerve supply to both the rhomboids is the dorsal scapular nerve. Both muscle helps in the retraction of scapula and hold the scapula to the chest wall. They are most active during swinging a sledgehammer. Muscle which lies underneath and deep to the subscapularis muscle is the serratus anterior. It is also called boxer's muscle. It originates with multiple digitations from the outer surface of upper 8 or 9 ribs. All the fibers converge and inserted into the costal aspect of medial border of scapula. Nerve supply is long thoracic nerve. It helps in the protraction and stabilization of scapula. It also assists in the outward rotation of scapula along with the upper and lower fibers of traps, for example, during the overhead lifting. Lastly, we have one small muscle in the front which helps to hold the scapula in place, that is the pectoralis minor, which you can see in the picture. It lies underneath the pectoralis major. It originates from 3rd to 5th ribs near the costochondral junction and get inserted into the superior surface of coracoid process of scapula. Nerve supplying the pectoralis minor is the medial pectoral nerve. It stabilizes the scapula by drawing it inferiorly and anteriorly against the thoracic wall. Thank you all for watching. Hope you like this video. Do share it amongst your friends and colleagues. Subscribe to this channel and press the bell icon for the future notifications.